Live Right Now. Tips and insights on living a healthy lifestyle brought to you by the health experts at Carthage Area Hospital, so you can live right now.
My name is Tanya Durr, Tonyadurr. I am an RN, a registered nurse at Carthage Area Hospital. I am a certified BLS, which is Basic Life Support CPR instructor, and also a HeartSaver CPR instructor for the American Heart Association. BLS, Basic Life Support, is the CPR instruction class that we are required to take here in the hospital and most healthcare workers take. And it's a little more advanced than a HeartSaver class. HeartSaver is primarily used for the general public. It's a class we encourage the general public to take: teachers, coaches, people who work in the mall, anywhere where there's a potential for a cardiac emergency, and that's pretty much everywhere. So we would encourage the entire community to take HeartSaver class. The cost of it is usually about $5, and there is no written test. That is a major difference between the classes that we're required to take as medical professionals and the classes that we offer for the general public. There is no written test. HeartSaver is a great class. You can learn to treat adults and children and infants who are having a cardiac or respiratory emergency, and also who are choking. So all those great things with infants who are choking and people don't know what to do, we do teach you what to do in a HeartSaver class for a choking infant or a choking adult or a child. And if you have a child who you witness have a cardiac emergency, have a respiratory emergency where they suddenly stop breathing or they have no pulse, this class would teach you what to do in cases of those emergencies. So I'll just give you a little brief overview of how this works. The biggest thing with HeartSaver and BLS and all of our CPR classes is, of course, chest compressions. Everyone knows that. You can't just start beating on somebody's chest. So chest compressions are done, and we'll demonstrate chest compressions are done with a locked hands. You place them between, in the middle of the chest, between the nipples, and you're going to do 30 compressions. And we like to do 30 compressions and 2 breaths, and we like to do 3 sets of that over 1 minute, so it equals about 100 compressions a minute. As you can see, Deb is giving it full force. We want to make sure that the chest recoils completely. When you give a chest, that gives the lungs a chance to fill up all the way and the heart to refill with blood. And we do 2 compressions. This is a face shield mask. A lot of people are concerned when they give breaths that they're somehow going to get some kind of disease. These masks are made with a 2-way valve that prevents anything coming back from the person you're giving breaths to. Then you just continue back on, and you'll notice when Deb gave the breaths that we watch to see that the chest rises. That lets us know that the air is getting all the way down into the lungs and oxygenating the blood. So basically what we're doing is when Deb is doing compressions, we're simulating the force of the heart, pushing the blood through the body to the brain and to the vital organs. And then when we give breaths, we're filling up the lungs with oxygen, so that then when she gives compressions, we're filling now the body with oxygenated blood, bringing that vital oxygen to the brain, to the heart, and to the vital organs. And basically, we're kind of buying time until more experienced responders can respond and bring advanced life support so that they can help this person. CPR is exactly that, cardiopulmonary resuscitation. We are basically trying to keep this person, their oxygen and blood flowing until EMS can arrive.
Live Right Now. Tips and insights on living a healthy lifestyle brought to you by the health experts at Carthage Area Hospital, so you can live right now.